Hello, my name is Dr. Ashley Parks, and I'm your instructor for the HCM 2110 course. And I am hoping to share with you all a little bit of my passion about careers and educational opportunities in healthcare, and a little bit about public health and health services in general. Most of you know my background, my bio, because we're in this course, and I've shared a little bit already. However, I think it's really important that you know that I am passionate about having these career development conversations with you. I've worked across multiple, what I call subfields in healthcare quality and finance and analytics and IT and project management. But I've also worked in different settings, health departments and hospitals, community-based organizations, ambulatory clinics, long-term care. So I really look forward to having these conversations because when I know what you're passionate about, I can provide you resources based on my experience and based on the connections that we have as faculty in the community. Now, when individuals think about careers in healthcare, quite often they focus on clinical careers. They think about being a nurse or an audiologist or a paramedic. But today we'll really be talking about and focusing on health services administration. This slide is just a few titles that I've had over the last 20 years in the field. Things like being a quality data analyst, analyzing health outcomes for a hospital, managing projects. I was a director of quality and risk management for a health system. I was a director for a program management office, implementing IT and clinical improvement projects. For a while, for about 3 years, I was a director of managed care, overseeing 4 different health plans, health insurances for patients with HIV and AIDS. I've done research. This is just me. This is just one person. So the sky's really the limit. You can try different things and figure out what resonates with you and what you're passionate about. This slide and the next slide are just a few of the domains and settings that are common in healthcare management and in public health. Now, with health services management, I think it's really, really important that you're aware, that you're cognizant of how many different opportunities there are. It's not just one thing. You can work in finance, operations, accounting, strategic management. You can design. You can work in real estate, even in healthcare. You can do so many different things. On the public health side, you can work with communities at an individual level or a larger community level, statewide level, but you can work with influencing behavior, outcomes, the environment around us. There are so many cool things that you can do. In healthcare administration, there's a lot of different settings. And this is just a list, but I'll show you a slide that links this list of settings. And another slide that shows the list of settings, and another slide that links the types of work you will be doing or could be doing with different related certifications. Now, as far as what healthcare managers do, we do a lot of different work. According to the Bureau of Labor Statistics, we oversee the personnel, people, facility operations, finance, and IT of healthcare organizations. Now, we do that in a lot of different ways by partnering with clinicians and physicians and nurses, by ensuring the healthcare organization is financially and operationally sound. We take care of business, if you will. Now, you may want to work in leadership. Maybe you're interested in a strategy, or maybe you're just interested in data and numbers and statistics. We all have different strengths. But some of the key skills in healthcare administration are leadership, the ability to interpersonally communicate, the ability to think, systems thinking, as we discuss in this course, and strategic planning for a large organization and for long-term needs, goals, objectives, mission, and values. And then, of course, budgeting, the ability to work in Excel, for example, to generate reports and to figure out how to allocate funds is really important. The next 2 slides are slides that I've actually posted separately in our course as well. I call it the Career Pathways document. This is a few very common settings in healthcare. Maybe you want to work in hospitals or long-term care, outpatient care, healthcare delivery, if you will. Maybe you want to work in the payers, the health insurance companies, and the healthcare financing. Maybe you want to work for the federal government, or maybe you want to work in the technology, supplies, and sales side of healthcare. So these are some of the really prominent, notable settings. And here are some of the prominent subfields: leadership and strategy, managing projects, implementing new systems, again, finance, and what we call decision support, which is really financial analytics, right? The idea of making good decisions based on what the data tells you. We've got the idea of fixing and improving processes, which is quality, performance improvement, limiting legal liability. We've got risk management. We've got keeping things regulatorily compliant, so compliance and ethics, doing the right thing. And then human resources. Human resources is definitely an under-pursued field when I see, as far as what I see new graduates doing. There's a lot of opportunity there, but not a lot of folks graduate and say, I'm going to go into HR. And I think they should, quite frankly. There's so many opportunities in the HR space. And then we have IT as well. Now, what you can see, the links to this file, the links in this file are clickable if you open up the file separately. And I've shared it as a PowerPoint for that reason. I want you to be able to go through and click these. These are different certifications that are available. I have several of these that you can see behind my name, and I recommend several. They are all from national reputable regulatory groups or associations that are there to help with your professional career development. If you have questions about these, that's where we set up a separate meeting and we talk one-on-one. So how do you know if healthcare management is right for you? If you're interested in working in a healthcare business, but you're not really interested in direct patient care, right? I know that was me. I was accepted in medical school, but then I discovered, I don't really love blood and guts. That's not what I want to do. And that's perfectly fine. Also, if you are interested in fixing processes, managing money, the administrative side of things, but you don't feel like you want to necessarily go into public health or community health or research, then healthcare management is likely right for you. That being said, there's a few notable fallacies, things that aren't true about healthcare management as much as some folks wish they were. One of them is that this is not a one and done career path. You can't just finish one undergraduate program and be done with your education. You can, but you will not promote likely to an executive level. At this point, we are in a growing but competitive field. You need to consider pursuing advanced certification and a master's degree. Also, I think the other notable fallacy is that healthcare management is not a single career path. We're not just administrators. There's so many, again, settings and subfields that we just talked about that you can go into. Graduate school. I love having those discussions. That may be a discussion that some of us have in 2-3 years, right? Give me a call. We can talk about what's right for you from a graduate school perspective. Many health services administrators have something called an MHA, a Master's in Healthcare Administration. My husband is a chief financial officer for a health system, and he has an MHA. I have an MPH, a Master's in Public Health, and an MBA, a Master's in Business Administration, and those are also appropriate degrees for someone working in health services administration. But depending on your role, your career goals, you may want to choose one over the other. There's also those certifications I just talked about. So I just wanted to put that out there one more time. This is the short list of ones I absolutely recommend. This other slide has longer ones that I have less experience with. But this short list here are key ones that I have experience with and highly recommend. As far as continuing education opportunities, the granddaddy, if you will, the ultimate, let's say grandmommy, grand person, right? The FACHE, the Fellow of the American College of Healthcare Executives, is the certification that a lot of executives pursue and get. So you see this listed on job descriptions for executive roles. And this is the ultimate general certification in health services administration offered through the American College of Healthcare Executives. As far as our career outlook, it's beautiful. Unfortunately, we have a lot of need in our country. And so the career outlook is incredible in that we estimate about 32% growth in our field of health services managers in this decade, which is about over 50,000 new job openings every year. And as we see an aging population, and especially a growing population in certain states listed here, right, we're going to see more and more opportunity. Now, those with a master's degree, again, have greater opportunity, and it has a huge impact on salaries. I'm not going to spend time today talking about compensation because that might even change by the time you graduate, but it's important to be aware of what you're planning and what will help you sustain your life and your family. As far as overall comp, the average for a health services administrator as of 2020 is just over $100,000 a year. And certain states that have a higher cost of living tend to pay a little bit more. So that being said, I want to shift gears for a second. You're aware that there are many settings and subfields in healthcare. The next few slides that you can peruse if you'd like to are an overview of a presentation that I've given at the American Public Health Association and the Association for University Programs and Healthcare Administration conferences. And this is regarding a study that I did. And I wanted to understand the key skills that hiring managers were looking for in new graduates entering the workforce in health services administration. I wanted to understand their readiness to hire undergraduates entering the workforce and the importance and value of certain key skills, including certain technical skills, applications, project management, diversity, equity, and inclusion. So I did a cross-sectional survey, and the goal was really to create informed recommendations to make sure I'm teaching you all the right thing to know. What competencies and skills do you need to develop? So I did a survey of over 1,100 hiring managers, health services administrators, and I interviewed 45 of them for an hour and recorded those interviews and analyzed those transcripts. And I used 2 different models to do that and a lot of different statistical approaches that are described here. I used the National Center for Healthcare Leadership's model. It has 28 key competencies and 10 key competencies from the American College of Healthcare Executives model. I took those 2 models together and I asked health services administrators what they thought were the most important skills for you upon graduation. I also asked them about technical skills and project management again, cultural competency, and I asked them to rank all of these skills on a scale of 1 to 5, from 1 being not essential to 5 being very essential for your career success. And these are the top 4 skills. The top skill is self-awareness, and that's defined as the ability to have an accurate view of your own strengths and your weaknesses, your development needs, including the impact you have on other people, and your willingness to address those development needs through reflective, self-directed learning and trying new approaches. Are you willing to grow and change and develop? That's the #1 thing they care about, followed by how well you speak and facilitate verbal communication, how well you can take initiative and responsibility for your work, and whether or not you can lead change. You can energize individuals around committing to making change and improvement. So pretty cool. I think it's really important to also note that I posted a link to a podcast that I did with Dr. Anthony Stanowski, who is the CEO for the Council for Accreditation for Healthcare Management Education, which is the group that accredits graduate programs in healthcare management. And him and I talked through these. And he has also done some data collection with healthcare management programs and with a group called Peregrine. And those findings align with what I'm showing you here. These are important skills. So listen to that podcast and you'll hear both my perspective and his perspective, Dr. Stanowski's perspective, on the skills that you should master. I did some additional data analysis looking at skills across settings and subfields. And so if you have questions or a very specific goal, right, you want to work in long-term care finance, come see me and I'll share with you what I learned about that subfield. All right, well, do not be a stranger. I've shared this with you today to give you a small piece of that greater vision, that greater idea of what you can learn and what you should focus your learning on in health services administration. So I hope that this was valuable for you and helpful, and I look forward to having some more of those discussions in our group sessions and one-on-one. All right, have a great week, everybody.